Knowledge of general anatomy as well as advanced anatomy is what really makes a cranial sacral therapist advanced or beginner. So when you look at different skulls or even feel your own skull, knowledge of where the suture lines are or even where your embryological sutures are is really important. An embryological suture is where one bone came together in utero. So if you feel your own forehead, you'll probably feel a little valley about midway. That's where a real fusion happened within a bone. But when you're talking about cranial sacral therapy, we run with more of a European model where these suture lines that you see in a skull are not fused and that they're actually a living joint. They're full of vascular tissue, nervous tissue, and this very special fiber called a Sharpie's fiber that really allow for that expansion and contraction within a suture line. You can look at any skull. This one's plastic, but if you were to pick up a human skull, you would even see these little islands within a suture. Those are called wormian bone. We're not really worried about those as cranial sacral therapists because they're all inconsistent among different skulls. So the next piece of cranial work would be the dura mater, or the arachnoid, or the pia. You were talking about your meningeal system. It's a covering that surrounds the whole brain all the way down to the coccyx where it blends into the periosteum. Within that, we have an intercranial membrane, which would be this blue structure. It's made up of the same thing. Dura mater, which is the outside covering, you'd call that the mother. The arachnoid, which is the middle, which is more like a spider web, that's where the cerebral spinal fluid flows. And then the pia mater actually attaches to the brain via the arachnoid trabeculae. So if we take this brain apart, you can see where that intercranial membrane folds in on itself. So we have attachment sites along the superior border, the lateral border, and all the way down to foramen magnum, which is where this tissue would surround. The reason that this piece of tissue is so important is because of how it attaches inside the skull. And this is a piece of tissue that you can actually manipulate the brain by pulling on these different skull plates. So by pulling on the parietal bone, by pulling up, you would actually manipulate the top of this tentorium or this falx cerebri. The falx cerebelli is down here at the bottom, and the tentorium is the flat piece that comes forward and attaches on the sphenoid and the occiput. So by doing something simple like an ear pull, you can see how pulling on this tissue would be easily manipulated. They've done some studies with unembalmed cadavers where they actually pulled on the ear and measured the force on this piece of tissue, and it only takes about 16 grams to actually manipulate the brain by pulling on the ear. So moving on with the tentorium or the falx cerebelli, cerebri, we're going to nickname it the tent from moving forward. So this piece of tissue would mimic this same blue structure that's inside the brain. You have a venous system that runs along the edge. On this model, I've used a highlighter to show the direction that the sinuses drain. And it comes all the way around this leaf, and then there's actually a sinus that comes down and it exits the bottom of the skull at the jugular foramen. So if you go foramen magnum, the next foramen up where the temporal bone meets the occiput is a huge hole where 70% of the blood return from the brain exits. And it also has 3 big cranial nerves that we're going to review later. This is a huge point for whiplash and a lot of throbbing headaches, dizziness. A lot of pathology can be treated just by working on this jugular foramen. Next, we're going to look at the system as 2 pieces. The front or the face is what we're going to call the non-physiological system, whereas the dome that contains the brain and the arachnoid, that pia, that dura mater, that meninges is going to be the physiological system. So if we take the non-physiological off, it leaves you with the ethmoid. The ethmoid's important for a lot of different reasons. It's paper thin, and sunlight will actually shine through your eye, through this ethmoid onto the pituitary gland, and helps you with circadian rhythm, sense of direction. So if you have a client who's dealing with a concussion and they're having difficulty with some of those symptoms, this may be a key place to look. You also have the sphenoid, which we have named the king of the cranial sacral system, which makes a attachment to the occiput, and it's the only joint within the cranial system as a synovial joint. It's like a finger or a knee or a shoulder, meaning it has a joint capsule that it's designed for movement. This is also a cool spot because this is where your soft and hard palate meet. So anytime you take an inhale, that pressure change on your sphenobasilar junction can actually help milk that cranial sacral system. Next we have your temporal bone, the occiput, and you have 2 parietals. You have 8 bones that make up the orbit, and lastly your mandible, and you have a zygoma over here with the non-physiological system. The hard palate is also a really important area because of all the dental work we have done, and we call it your avenue of expression. This is how we love, this is how we eat, we breathe, we do everything with our mouth. So if we have a dysfunction within our mouth, it's going to have a global effect on this physiological system. So we're looking at the palatine, the maxilla, the vomer is still attached here. It makes a tongue and groove attachment onto the sphenoid. Your conchal bones are inside your nose. You have your nasal bone and then your lacrimal bones. When I treat, a lot of my clientele have had blows to the face. They've been in car accidents. Sometimes treating the non-physiological system is more important than treating the physiological system.